Hello, this is Melissa Galloway, a student at American Sentinel University, School of Nursing and Post University, SIM 437, Baccalaureate Generalist. This is for a comprehensive older person assessment. For this comprehensive older person assessment and home safety checklist, CJ was evaluated. A comprehensive older person's evaluation and home safety checklist were completed with her consent. Conclusion from preliminary cognition questionnaire. The client was able to accurately answer the questions from the cognition questionnaire. Throughout the assessment, it was determined that the client does make choices that jeopardize her safety. However, she was able to voice the risk associated with her choices. When discussion of complications of uncontrolled diabetes, she openly stated that she understood that her foot may need to be amputated. Conclusions from demographic data. The client was a Caucasian female who did not complete high school. She lives in a single-story home with a wheelchair ramp to the front door. Conclusions from social support data. She is divorced and 2 other adults live with her who are not relatives. She does stay in touch with family and friends. She is satisfied with the level and amount of interaction with her family and friends. She does feel that she has the help as long as help is needed. Conclusions from financial data. The client does own her own home. She has Medicare as well as Medicaid. Her source of income is a Social Security check monthly. She reports that she does have ample income for her needs. Conclusions from psychological health data. The client was happy to share her interest of paint by number and scratch off by number. She believes these art projects do keep her interested. She reports being happy most of the time and only feeling down when her foot hurts. She reported that she does sleep more in the daytime and awake more at night. Conclusions from the physical health data. The client reported that she had 3 days over the past 30 days that she was sick and could not do her usual activities of painting. She rates her overall health as fair. She believes she needs the assistance of a nurse to address her foot wound, which is her chief complaint. She reports the inability to walk and uses the electric wheelchair for mobility. She reports her health problems stand in the way of her doing things that she would like to do a great deal. She does believe she needs help with daily activities, and the adults who live with her provide this assistance. She reports having lung problems, hypertension, a history of pacemaker placement, diabetes mellitus, a foot ulcer, hearing problems requiring hearing aids, vision problems requiring glasses, a history of falls, and pain in the feet. She reports having had the flu, pneumonia, and COVID vaccines. Her medications include oxycodone, furosemide, apixaban, Novolog, and gabapentin. She reports she sometimes does forget to take her medication and uses a pill planner to help her remember. Conclusion from activities of daily living. She reports that she does not need assistance to use the telephone, handle money, feed herself, dress herself, get in and out of bed, prepare meals, or getting to the bathroom. She reports she needs assistance with getting to places out of her home, shopping, performing housework, and bathing from the sink. She reports having help in the past 6 months, shopping, housework, and also she reports she has had help to get into the shower. 3 health promotion teaching opportunities. Due to the history of falls that this client has, falls interventions would be the first teaching opportunity. Removing throw rugs will reduce the risk for falls, and that's from the Centers for Disease Control and Prevention. This client will be instructed to clear her walkways of clutter. Instruction will be provided on extra lighting and night lights. A second teaching opportunity for this client is diabetes chronic disease management, as it is likely contributing to the delayed wound healing. This client needs instruction on the risk factors associated with uncontrolled diabetes. Hyperglycemia in older adults increases the risk of cognitive decline, and that's from the American Diabetes Association. Counting carbohydrates would be an important item to review with this client. A third teaching opportunity for this client is fire safety, as her mobility is dependent upon a wheelchair and she has no fire extinguisher present in the home. Her electrical items are left plugged in when not in use. And these things were concluded from the home safety assessment. The smoke detectors are out of date and have not been checked. Client would need to be instructed to check smoke detectors routinely and change the batteries when the times change and the clocks are updated. Client needs instruction to obtain a fire extinguisher for her safety. Client may also be instructed on community resources that may assist with these safety devices. Thank you. That is the end of my report.